Thank you, Deputy County Executive Jenkins, for the introduction. And I thank the Westchester County African American Advisory Board and Board Chair, Barbara Edwards. Thank you. Thank you also to County Executive George Latimer. Thank you for your support of healthcare. I wish to acknowledge my fellow honorees, Dr. Glenn Davis, Mr. Olney Reynolds, and my friend, Mayor Sean Patterson Howard. On behalf of all frontline healthcare workers in Westchester County, I am honored to accept the Esprit de Corps Award. It was around this time last year when the coronavirus first announced its arrival in Westchester County. It hit us early and it hit us hard. Westchester County shut down and its healthcare workers stood up. They set aside their own personal safety, summoned courage, overcame fear of the unknown, and went above and beyond their duty to save thousands of lives at great risk to themselves and their families. Meanwhile, as the war raged on, it became clear that the virus had unmasked another problem. According to the CDC, COVID hospitalization rates for Blacks are 5 times greater than that of non-Hispanic whites, while the death rate for Blacks is twice that of whites. And for those with underlying diabetes and heart disease, hospitalizations are 6 times higher and deaths 12 times higher. Disease is a cruel teacher. The coronavirus is one of the cruelest I've ever encountered. But the lesson here is beyond valuable. What the pandemic has done is expose an underlying public health crisis, a chronic disaster, if you will, that has been afflicting and killing African Americans and minorities for decades. Poverty, unemployment, hunger, crowded and substandard public housing, violence, threats to public safety, limited access to healthy foods. These and other social determinants of health combine to leave our entire communities at increased risk for the chronic diseases that have left us particularly vulnerable to the lethality of COVID-19. If we beat the virus, but do not address these inequities, we will have failed in our duty, not only as healthcare providers, but as public servants, community leaders, and good citizens. America changed its behavior in such profound and fundamental ways to mitigate this virus. And I dare to believe that we as a people have the capacity, the nobility, to summon the same selfless courage and determination to establish equal justice for all and finally prove the true strength of our shared humanity. Thank you.